everyone. Okay, cool. Well, hello and welcome to Ask the Doctor. My name is Chinwendu. They call me Chin, and I'm with the Grapevine Health team. Grapevine Health is a health media company, and our mission is to deliver relatable, easy to understand health information that you can trust. So, one of the ways that we do that is with our Ask the Doctor sessions. We want to give you the chance to ask your health related questions and get real answers right here, right now, from wherever you are. So, today we're going to be talking about mental health. And in honor of National Minority Mental Health Awareness Month, we've partnered with Dr. Allison Mitchell to talk about ways to improve your health and your family's mental health. Before we get started with the questions, you're going to notice a QR code that's on your screen. If you use your phone to scan the QR code, it'll take you to a quick 5-minute survey. The survey asks you a few questions that will help make our health programs even better moving forward. So if you can, please take a moment to complete it. And if you're a Fairfax County resident, you have an opportunity to get up to $40. So there's a little extra incentive. So as you take a moment to complete the survey, I'm going to go ahead and introduce our amazing guest for today. Today we have Dr. Allison Mitchell. She's a psychiatrist with years of experience treating a variety of psychiatric and psychological conditions. She specifically specializes in holistic psychiatry, which is where she takes her approach to her work in a way that not only looks at the presenting mental health challenge, but looks at the individual in totality. So she's connecting your mind with your body, spirit, and environment. She also is a former educator, which has inspired her initiative to educate those in her local community and abroad. So today she'll be answering any questions people may have about mental health, particularly how do we prioritize mental health for ourselves and the people we consider family. I'm going to go ahead and let Dr. Mitchell go ahead and say hello and introduce herself personally, and then we'll get into the questions.
Hi, I'm Dr. Mitchell. Very excited to be here. I'm glad that each of you are here as well to gain insight into your mental health and how you can better it, not just for yourself, but also the people that you love.
Before we get started, I just want to remind everyone that we will be, if you have any questions, we'll be using the chat box below. It's very open and a judgment-free zone, so just remember there are no wrong questions. So I'll get started with a really common question is like, what are signs that someone is struggling with their mental health? Like, how can I be able to tell that I'm struggling with their mental health or can recognize it in the people around me?
That's a great question. A lot of people don't really know what is normal or what is not normal as it pertains to their mental health. And I would say how you know you're struggling is if you think of a time when you were doing really good, things were going well in your life, you felt like you had internal peace, you had control, you didn't feel overwhelmed, and you compare that with where you are now. If there's a level of dysfunction that is there, if there's a level of emotional or psychological distress that is there, where you're not able to engage in the same activities, you're not able to complete the same types of interactions, that's how you know perhaps there is something deeper going on.
Right. So just paying attention to any signs, like any changes in my behavior and like in the behavior of the people around me. Right. So what if like, how do I know if I'm depressed? This is another common question that we hear, especially if you're getting up daily and going to work or school, you're not crying all day. I guess these like common symptoms that we hear and see that are associated with depression. How can I
Sure.
recognize if I'm depressed or if someone like my child is depressed or my husband or a family member is depressed?
So, depending on your cultural background as well as your age, depression can look very differently. In young people, those that are teenagers and younger, depression can look like irritability, lack of patience, emotional outbursts, isolating behaviors. When you get to adults who have families and have jobs, a lot of times depression can go unnoticed because they have functional depression where they still push through and do things that are requirements, but then they don't really feel joy or fulfillment inside.
Mhm.
And so for adults, you really look at change in sleeping patterns. You look at social interaction. Are you now a recluse where you used to be super bubbly? You look at your ability to find joy in activities that you once did. You also look at your energy levels. And if you're finding that your mood is maybe not sad and down and crying all the time, but you're just not happy and emotionally you feel removed from your environment, um, you have a change in sleeping patterns, and you're just not able to find that joy like you used to and things that really used to make you happy, those could be very strong signs of depression.
Yeah. I like the fact you mentioned, like this term that we see a lot of floating on Instagram, high functioning
Mhm,
depression.
mhm.
And that can look very differently because even though you are showing up to work, even though you are getting up and doing your day to day
Yeah.
things, that doesn't indicate that there isn't something deeper going on underlying. And like pointing to those other symptoms, like you said, like changes in your sleep, for not finding joy in the things that you once found joy, like paying attention to those things. And seeing that like depression doesn't only look one way. And you also pointed out how depression can look differently in children, and in teenagers. Like there is definitely like teenagers, they're known to during that time period, during adolescent, that entire adolescent period from
Mhm, mhm.
about 10 to 19. There's a lot of different like hormones going on, a lot of changes
Sure.
happening in the body that can
Yeah.
impact their mood. So sometimes it may be hard to determine what is just normal
Mhm.
developmental behavior
Yeah.
and what is, I guess, considered quote unquote abnormal, right?
Yeah.
So just pointing towards that. What are some ways that we can be able to tell like this irritability or this attitude that my child is having with me is maybe more connected to just like hormonal changes or developmental um, behaviors rather
Mhm.
than okay, there might be something deeper going on.
Right. It is true that as young people grow and they are looking and trying to balance those hormones, navigating life, trying to figure out who they are, that they may have this irritability. They may be more socially different, not laugh at the parents' jokes as much anymore, not want to hang out with mom and dad. But you want to look at the frequency and severity of changes that happen. So you should still be able to connect with your child. They should still be able to enjoy things. And if every day, day after day, for weeks and months at a time, behavior is progressively getting worse or going away from who they used to be, then that would be a cause for concern to where you maybe should take them to a mental health professional or even just to their primary care doctor, which is usually the first point of contact to say, hey, these things are going on. Should I be concerned as a parent, or is this um, expected behavior? We don't like really in psychiatry like to use the term normal because everyone has a different level of normal for them, but we
Right.
look at baseline versus where a person is when they come in. So is this far deviated from a person's baseline behavior 6 months ago, a year ago?
Right. So now with that being said, another question that comes up regularly would be now that if I see that or recognize that, how what would be a good way or not a necessarily a good way, but what is an approach that you would suggest to go about checking in or even like introducing the concept of taking my child now to therapy or to see a professional about whatever it is that is going on?
So you mean from the parent's perspective, what would I recommend?
Yeah, from the parent's perspective. Well, I guess there are two parts to that question. So the first I'll ask though is like from a parent's perspective, how to approach that to my child, like how to
Mhm.
bring up that conversation as well as suggest or introduce the idea of seeing a mental health professional.
Sure. I think it's always good as a parent to check in with your child's mental health from a very young age, asking them why they're crying, why are they upset, learning how to articulate their emotions. And once your child can get comfortable with articulating their emotions with the parent, those conversations become very easy. Where, okay, let's do a check in today. How are things going? Let's do a check in for this week. And then be honest with your child's level of understanding that mom or dad is concerned. So if you're speaking to an 8-year old versus a 16-year old, of course, the conversation is going to look very different. And so with very, very young children, usually parents take a very soft approach and say, hey, mom is worried or dad is worried that you've been really upset a lot lately. What are you feeling inside? Maybe we should go to the doctor and get some help. And most children understand that the doctor is there for help, And you might not have to elaborate greatly with very young children that you're going to see a psychiatrist or a therapist versus like a physician, a pediatrician, or an ENT. When you're
Yeah.
dealing with adolescents, they have already kind of been exposed to what mental health is. They have their own preconceived notions and expectations. And it's good to approach the conversation in a manner that allows them a safe space to express themselves. Some teenagers don't feel like they have that at home. And so if parents open up the conversation saying, I really want to hear from you, what have you been going through? Why is it that you get upset sometimes? Or, don't want to be apart, and then draw that into out of care, concern, and a desire as a parent to do your due diligence, that you think it would be important to go to speak with someone that might be able to help.
Right. You point to two different things that I thought of as you were saying that. One of them being this, like, there's a certain level of prevention that comes in, that
Mhm.
comfortability and like bringing that up. Just because the child first, you have to have that, I guess, open line of communication where you can feel comfortable going to your child and your child also feels comfortable speaking to you. So that is definitely a relationship that needs to be cultivated over time, that you may or may not see as commonly, especially when it comes to expressing emotions,
Yep.
commonly see in a lot of families of color. So it's
Hmm.
really important that we, I think, take that narrative, like take that, the takeaway from that is really like normalizing these conversations just about your overall emotions, not even necessarily in a time of crisis when you
Hmm.
know that something is wrong, but more so as a prevention, more so as like having that open line. So if something is going on, they can also feel comfortable coming forward on their own. So
Right.
that's also important. And then the other thing I think of also is the pandemic
Hmm.
and how that has probably impacted. You talked about how we definitely, this new generation of kids are definitely way more open and hearing more often about mental health and speaking to a professional and signs of different mental health challenges. I wanted to ask, how have you seen, especially maybe prior to, during, and then now, I guess kind of in this weird like post
Hmm.
era
And
of pandemic, yeah, where it's like, what have you noticed have been the major effects of the pandemic on children, adolescent mental health? And well, I'll leave that there.
yeah, with young children, some of them, there's a population of young children that have been greatly affected because their social skills perhaps have not gotten to the point where they would be if they were going to school. Routines have sometimes been changed. So now that younger children are going back into schools, parents and families are navigating the social structure, or that child learning the social structure, interacting with others, balancing their emotion, learning how to have self discipline, in the classroom. Um, and it's really a learning experience. And then you also have the side of those young children that they feel down because they don't feel as though they fit in and they feel different. And so I've seen an increase in anxiety in younger kids, as well as depression related to either being out of the classroom for an extended period of time, or even going back into the classroom. Of course, you have some children that are outliers and do well and are thriving, but there's a pretty big population of children who are experiencing difficulties with navigating the transition. And then with older adolescents between the ages of 14 to 18, there's a group of students that are really thriving by being able to pace themselves, and their mental health is exploding because now they don't have to worry about social constructs and comparing themselves to others. And then you have the other side of that group of individuals that they really are struggling because there's been a deficit of things to do in their lives, outlets for them to have extracurricular activities, social functions, the ability to go from one class to the other. And school brings a level of support that public school or private school brings a level of support that's just not there when you're at home, because you have all these teachers, you have all these coaches, you have all these friends that you're seeing day in and day out. So when that's taken away from an adolescent, it really can cause the floor to not be as sturdy as it would if they had more levels of support. And so I'm finding that those adolescents are sometimes having trouble navigating those high school years and where they fit in, even with making decisions of what to do next in life. So, again, seeing a spike of anxiety, depression, but also being very open to getting help.
Right. Yeah. So with that, how can a parent or a teacher or family friend, how can we support our child moving forward now that we are seeing a lot of the major effects of how the pandemic has impacted
Yeah.
everyone's mental health on some level, but just
hmm
more so speaking to children's mental health currently.
For parents, I believe it's important. It kind of goes back to that safe space and letting the child know that their emotions, their feelings, and their thoughts concerning their mental health and how things are going internally is valid. And so you always want to validate your child, what they're going through, and not be dismissive, because even though parents may have grown up in a different time, I'm a millennial, but then they're baby boomers that are also still raising young children, and they may not be able to really connect with a child nowadays who's going through high school in comparison, having everything at their fingertips. But I believe from a parental perspective, it is important to always be a learner to your child, even. Um, and when you take that approach, when you're having a conversation with your child, because you're learning about what's going on in their mind and how it's affecting them, you'll always be able to offer a level of support that without that conversation, honesty, and openness would not be able to be achieved. So, my kids are young, but my 4-year-old is old enough to articulate that he's sad, upset, or mad about something. So I give him the space during time periods of frustration and disappointment to express his feelings. And then at the same time, I validate those feelings while encouraging and supporting him that it can change, that it can get better, and that he can do better if he's disappointed in himself. So when you open up a conversation with your child as a parental unit, authentically loving your child, you'll be able to speak comfort and support and love to the places that they say are in a deficit.
Right, right. No, I love that. So we have a question from an educator who wanted to know what are some signs to look for in a child that may be experiencing any form of abuse,
Mhm.
and any advice for how to ask that child or a child that you care for about abuse.
Yeah, so again, it kind of depends on the age. I used to teach not just high schoolers, but second graders. And so I would say if a child is a lower elementary, how you navigate that conversation is going to be very different than a child that's in middle school or high school. So I'll kind of take that approach or thought process of it. Children who are being abused don't always show signs and symptoms at school. Sometimes they thrive. And then other times they are very shy. They don't really feel that they can do anything well. They're very hard on themselves and they mimic the language and behaviors that they see at home. So if you see a child that is acting in a very deviated way from the neurotypical population of children, so the average child, in the way that they get upset, in the way that they speak, in the mannerisms that they use, then that would be a sign that something perhaps could be going on at home. And I always, recommend that if you think some type of abuse is going on, that you seek out like the school guidance counselor who has more experience and training in approaching a child and asking questions. Of course, you can always tell the guidance counselor why you might be um, concerned about it, what may be going on, and they may already have an inkling because a different sibling went through the school system, earlier. The great thing about education is there's always a point of contact for something that you feel is out of your wheelhouse. Things in the classroom, of course, you kind of are a counselor for your kids, you are a teacher, you're a stand-in mom or dad. But when it comes to abuse, there should be a point of contact also on campus that can help you navigate approaching the child and talking to them. And sometimes you're not directly involved in that, they are.
And I know even since the pandemic, a lot of kids have been spending a lot of time at home more
Mhm.
often than usual. So there has been higher rates or higher reported rates of
Yeah.
different types of abuse, whether it's sexual abuse, physical abuse, emotional abuse. So just something for not just educators to be aware of, but anyone that works in any type of or has any interaction with children. It is important to at least be aware of maybe changes in their behavior, anything that might be impacting, oh, that there's something deeper might be going on.
Mhm.
Um,
Mhm.
so I want to pivot slightly and kind of ask more about how to check in with our friends and our loved ones or adults in our life that may, I won't say more fixed in their ways, but more used to operating a certain way and wanting to maybe either bring their awareness into like their mental health or just if even if you feel like something might be off, how do you approach that conversation? How do you check in with them? How do you ask them in a way that I guess that does not feel stigmatized or add to the stigma? But we know like it shouldn't be as stigmatized as it
Yeah.
is, but there is still though a great population of people that still do, even though they'll recognize it in other people or be
Yeah.
open to talk about it in other people, still have difficulties maybe seeing it within themselves.
That's a great question. And the answer is very different based on the person. You have people that are introverted by nature, and you have people that are more extroverted by nature. The saying around social media is check on your strong friend. And that's not always obvious in friend groups of how to do that or when you should do that. I believe if you truly care about a person, then you want to simply ask questions and you can invite that person out, to go with you somewhere if you're concerned, maybe something that you know they enjoy doing, kind of observing their behavior, how they interact with you, and taking a moment to connect with them in a very humble way, express why you might be concerned and ask them if they're okay or how are they doing. And sometimes people will be like, "Oh, I'm fine, I'm okay," but as a friend you can ask them to go a bit further. Well, I noticed you haven't been going to the gym as much as you used to. I noticed that you've been really short with the kids. um, I see that you've barely gotten out of the house, in the last month. We used to talk every day, we barely talk at all, so I know something's going on. It's okay. You can tell me. I'm here to help. I believe that when people are in a place of depression, anxiety, or psychological distress, um, and they're functioning, they learn to have this poker face. And it may take more, I don't want to say prying, but it may take a longer line of questions followed by comfort speech, in an empathetic way so that they know you're truly concerned and that all you want is for them, to be honest and open in that community in that particular conversation. And sometimes it might look like you sharing a part of your life that mimics where they are. Like, hey, I remember when I wasn't really being myself and this particular thing happened, that I was actually struggling and I was depressed. And I wish somebody would have asked me because I really did need some help.
That you pointed out was empathetic, like just showing that level of vulnerability, I think also does kind of bring people into that
Hmm.
we are all humans. It brings you into the human
Yeah.
experience and at least allows a person to then want to let their walls down and also share. So I think that that was definitely the key as well in like checking in with other people on their mental health. I also wanted to take a step back though really quick. And also I know when people hear mental health,
Hmm.
I think that they think of something outside of themselves or they think of something extreme,
Yeah.
or maybe mix it up with mental illness.
Hmm.
So I just wanted to have you like answer what is mental health and what is the difference between mental health and mental illness?
Yeah. So mental health is something that affects each of us, just like
Mhm.
physical health does, or hair health does, or skin health does. It essentially is the psychological and emotional state of your being, how you are navigating your emotions, your behaviors, and actions as you go through life. And mental illness is distress in those psychological states in your mind that affect your emotions, your behaviors, and your actions. So, people who usually meet criteria for mental illness, there's a level of dysfunction in their emotions and psychological state. There's a level of distress there that's affecting their everyday life. And being concerned about your mental health doesn't automatically mean you have a mental illness. And even being in therapy because you're concerned about your mental health doesn't automatically mean you have a mental illness. I kind of akin it to if you're concerned about your physical health, heart health, you go to the gym, you work out so that you can maintain a healthy physique, healthy coronary arteries, great breathing techniques so that you can live long. It's almost like keeping your mental health as a priority is going to be preventative in deterioration in the future. Even if it doesn't lead to a mental illness, people can still experience dysregulation if you don't prioritize your mental health.
Right, right. And then, so if I recognize that there may be like signs of a possible mental illness there,
Mhm.
how do I suggest talking to a professional or suggesting therapy to a loved one?
You always come from a place of love when you're speaking with someone that you have a personal relationship with. Sometimes people can feel attacked, ganged up on, embarrassed. And so, any type of non judgmental verbiage that you can use in a place that is private,
Mhm.
where you first kind of start off expressing your concern for them, your love for them, and offering help and them seeking out professional help, whether that be, hey, I have this therapist that I've been seeing or that I know of who's really well. I think this person may be a good person for you to contact. Or, hey, maybe we should go make an appointment with your primary care doctor to see if this is something that there's treatment for where you can get better. Um, I believe just making sure that that person is aware that in that conversation, it's more concern and love driven than it is judgment and malice driven.
Right. I also wanted to ask, like, so what, because when people hear mental health professional or seeking help,
Hmm.
what are the difference between the different professionals, whether it's therapists, psychologists, psychiatrists?
Yeah.
Do you mind just going ahead and breaking that down, like the difference between the different professionals and maybe even who to go to for what specifically,
Yeah.
or the overlaps maybe and the different
Hmm.
ones? Just we can speak more to that.
Okay. So I would say the difference between counselors, therapists, psychologists, and psychiatrists is usually expertise as well as focus of training. It's a double sided coin. Counselors usually complete some type of program, accredited or not, that may or may not be associated with a university to help people bring a level of support and be able to offer advice. And then you have therapists that really covers a range of mental health professionals, all of which are usually credentialed and accredited by a national governing body that also have an undergraduate degree as well as some type of graduate degree. So you have licensed clinical social workers that go through 4 years of college. They do a master's and an internship with a therapist in order to practice independently. You also have social workers that like work in hospitals that may not be licensed clinical social workers for therapy, but they also are able to offer counseling that also go through the same degree requirements, and the focus is usually social and psychological of what is learned in their coursework. But there is always some type of graduate degree. It's just that the licensed clinical social workers that practice independently have taken an extra step and completed like an internship in order to uh, provide therapy services. And then you have psychologists that are PhDs are PsyDs. So they went to undergraduate school, usually in sociology or psychology, and they did another 4 years of graduate work, usually 4 to 5 years, where they specifically learn about all the different types of therapy. This is considered a terminal degree, meaning it's the highest level of training that any person can achieve in therapy surrounding mental health. So these are considered therapy experts by all means. And there are some states that allow for psychologists to prescribe. I think Louisiana might be one of those states. And then there are psychiatrists like me, where I went to 4 years of undergrad, 4 years of medical school, and then 4 years of residency, where my medical school was general medical education, like all physicians go through. And then my 4 years of residency, one of those years was an intern year where I focused on kind of all branches of medicine, but then I had additional 3 years that specifically targeted psychiatry and mental health. And in my training, which I probably can attest to the most, we studied not just the mental health from a counseling standpoint. So we did learn, or should I say, I did learn all of the therapy involved with patients, but also treatment of mental illnesses through pharmacologic means, so medication, and how all of these tied into underlying medical health. One of the reasons I chose medicine is because I was interested in the body. And one thing about psychiatrists is that we are always trained to look at your underlying physical health in alignment with your mental health, because there are disease processes, autoimmune and infectious in nature and others, that can manifest as a mental illness, but it's really a medical condition. Um, and so physicians, as a psychiatrist, is also a terminal degree, and I'm considered an expert in treatment of mental illness through pharmacological means. And there are varying levels of training that psychiatrists go through for therapy.
So how can one know maybe who, like which professional they need to see, or
Sure.
which one would be best for them, or maybe even what type of therapy? Like what is it? What as someone that is interested in seeking help, what should I be
Yeah.
looking for specifically?
So I think it starts with where your level of functioning is. Someone who is still able to function, going to work, doing what they need to do, don't feel as though they're having breakdowns every single day, don't feel like they have to have, time off from work. They're not hallucinating, are behaving bizarrely, or having these dissociating episodes. You likely can start with seeing your primary care doctor first, or seeing a therapist first if you know you don't want to start a medication. Many primary care doctors have been trained to identify mental health disorders and be able to treat them with medication. And if you don't want medication, usually they also have references. Sometimes what I tell patients and people that I meet in the community is contact your insurance company, request a list of mental health providers, including therapists and psychiatrists and psychologists that they cover. And then from there, you can always vet those services. Go to their website, go call them and see, okay, what types of things do you treat? And then if you feel as though someone you know or yourself, you are completely derailed and in utter distress, maybe the darkest time in your life, you likely want to seek out help of a person that is considered an expert in the field of mental health, whether that be a psychologist because you want to stay away from medications and have therapeutic interventions, or a psychiatrist if you want to make sure medications is not something that you need or that would be most beneficial. What I usually like to tell people is my recommendation to starting a medication is the level of dysfunction that you're currently having. And if you feel as though you can take the time to continue on with psychological counseling or therapy, as it takes a bit more time to work perhaps than the medication does. Clinically speaking, studies show that people get better sooner and stay in remission of mental illness and the symptoms associated when they combine both therapy as well as medication. Doesn't mean you'll be on medication the rest of your life, but if you're in a state of turmoil and distress, usually that is going to be my recommendation.
So we had a question come up in the chat. Someone asked, how do I talk to a loved one about their alcohol or drug use?
That is a really hard area to approach with most people because it depends on that particular person's level and desire to get well. So, on the road to sobriety, there are about 3 to 4 steps of where someone is in that road. You have the absolute point of denial, you have the point of contemplation, you have the point of, okay, I think I accept that I have an issue and I'm ready to seek help. And then you have those that are automatically ready to seek help. If you are dealing with a loved one who is perhaps in denial, that conversation will likely best be had, not in just a one on one setting, but likely with a small collective of people that will be able to speak to that person in a loving manner and let them know how their alcohol use has affected them, as well as letting them know that you're worried they're at the point in their life where they're at the point of almost losing who they are. And sometimes people then will start, taking a look in the mirror and realize I'm really affecting my family, I'm affecting my marriage, I'm affecting my job, and then they decide to get better. And then you have other people where they have to hit the lowest of lows before they come to terms with them having an issue and their issue truly being a problem that they then desire to rectify. For most people who suffer with addiction, clinically speaking, rehab has been the best modality for treatment that has brought about the greatest form of remission. So there are people that kind of stop cold turkey, but that is few and far between. Most people have to go through some type of program. There are inpatient rehab programs and outpatient rehab programs. So if you have a person that you love and you want to talk with them about it, perhaps you look in the area of some resources of places that provide services, and in that meeting say, hey, I really found this place and they offer services. You can go 5 days a week, a couple hours a day. I think it'd be great. It's a 30-day program where you'll learn different ways of navigating your addiction. A lot of those programs, you see a psychiatrist every day. And so they start medications to treat any underlying mood disorders, because most people who abuse a substance, it's to mask or cope with in an unhealthy way a mental illness that they have. And so most people, they just don't know what to do with the anxiety or the depression or the trauma that they've experienced in their life. And so they drink or they smoke or, they shoot up. But if they're able to get the underlying issues addressed and treated, then oftentimes recovery can come.
Right. I think it would be really helpful to break down the difference, or when to understand that recreational or alcohol or drug consumption. When is it a problem? When is it considered a problem or disorder or an addiction?
Yeah, that's a great question. So you have recreational use, and then you have a level of dependence, and then you go into abuse, which substance abuse is, for all intensive purposes, an addiction. In order to meet criteria for having a substance abuse problem or addiction problem, there's 9 criteria out of a 15 kind of list of things that has to take place. Some of the common ones is trying to quit on your own, not being successful, trying to decrease on your own, not being successful, it affecting your personal relationships, it affecting your job, hiding it from others, being uncomfortable about your substance use, like embarrassed that it's there, having any type of legal or financial issues due to your substance use, and then missing family functions or engagements because of your substance use. So if you answered yes to about 5 to 7 of those, are someone you could answer yes for them, it's very likely that they have a substance abuse issue and they are suffering from addiction. And then you have people that are dependent on substances, and the dependence comes in when the body kind of goes into withdrawal when it doesn't have it, like prescription medications, opioids, benzos, alcohol. Some of which the withdrawal is uncomfortable but not life threatening, and others where the withdrawal is life threatening. So if you have a loved one that no, they don't do all that other stuff. Perhaps they haven't missed anything. They're not blacking out. They don't have DUI. They have let our kids down. Excuse me. But I noticed that they don't drink for so long, then they, pass out or start shaking or they start behaving bizarrely. Oh, I notice if they don't have this particular medication so many times a day, they become a nervous wreck and they're talking out of their head. They have headaches and upset stomach and things of that nature. That could be signs of a dependence issue, if not an addiction issue. And then the recreational use that kind of leads along to the addiction potential is when you have people who say they use it recreationally, but it is used as a poor coping mechanism and not truly just recreationally. Like people may have candy recreationally. However, if you're using candy to mask your depression and make you feel better in the moment, then there's a deeper issue going on. Doesn't mean you're addicted to candy, but it does mean that there's something that you're trying to heal that the candy will never heal. And sometimes people do that with substances, or a lot of times people do that with substances, alcohols, benzos being Xanax, Valium, Clonopin, things like that, and opioids as well, where patients or people will say, okay, I smoke weed, which is a recreational drug now, because it helps with my anxiety. But those patients and people don't know that marijuana has been clinically shown to increase the symptoms of depression and anxiety over time. So even in the moment, people feel good, but when I asked them to think back, well, how were you a year ago? They were actually better, before they started significantly using. And so one of the indicators for me that there may be an issue, maybe not addiction, but an issue, is when a person realizes that it's bad for them and they still do it anyway.
Mm. Yeah. Yeah. And I think that right there is really where I think it's that from that awareness now and then moving into, okay,
Mm-hmm.
actually being ready to make a change. Um,
Yes.
and that's, I think, the big indicator, like, okay, there's something off, there's something wrong here. So we had someone ask, so they have a dad that struggles with alcoholism,
Mm-hmm.
but it's very unspoken in their family. And
Mm-hmm.
her question is that she is also noticing similar tendencies, like alcohol is a way of bonding with her father.
Mm-hmm.
And her question is, how does she, now that her awareness of it, how does she, I guess, wane herself off of it or like address it in herself, especially when it's something that she attaches to comfort and her family, familial comfort.
Yeah. I think it's important when we have any behavior that we realize is not a healthy one, where it comes from and why we do it. And we have to ask ourselves as adults, and this is a part of kind of doing the internal work when you are in therapy. Um, what part of yourself are you trying to heal, and are you trying to heal it appropriately? So if this person is engaging in this behavior specifically to connect with their dad, because perhaps their entire life they felt like they were unable to connect with their dad, it's going to be important that they process that particular aspect of their upbringing so that they don't engage in an activity that will bring them comfort, but a false sense of comfort because it's not founded on true connection. It's diluted and tainted with alcohol. And so, through therapy, I believe a person can process that and what it means in their life, so that they don't, kind of go for the alcohol as a means to an end, but instead they desire to maybe, you know what, let me try to have an honest conversation, with my father about sobriety and about how maybe me drinking caused me to think as though this was the only way to connect. Sometimes honest conversations can bring about change in people um, that would not yield itself if those honest conversations haven't taken place. And oftentimes, adult children have just as hard of a time being honest with their parents as they did when they were 5 trying to be honest with their parents, or 15 trying to be honest with their parents.
Mhm.
Because you still feel like that little girl or little boy, that your mom and dad's judgment or acceptance and validation is what you really want most. And we all have to become comfortable with not having the validation, or maybe not having the connection with any party in our life that may lead to a negative end, if the only way we can engage with them is dysfunctional or toxic, traumatic, or an unhealthy coping skill. So that's a really long answer to that
Yeah,
question.
no.
There's not really just a this is what you need to do, but that's kind of the road of getting there.
Yeah. No, no, no. Because I think you really pointed to a lot of different gems in there, particularly as we're navigating life as adults and those roles shifting, with your parents.
Hmm.
And then just it can be hard to have difficult conversations with
Yeah.
your parents, especially as adults. And I think, like you pointed out, understanding where maybe that fear comes from, but also like
Hmm.
it's a part of the work, it's a part of that
Hmm.
responsibility
Hmm.
or accountability that takes place, and at some point it's a conversation that's going to have to be had.
Yeah.
Um,
Something
yeah.
that I tell my patients often is, when you continue to engage in behaviors that are almost destructing in nature,
Mm,
um, or dysfunctional in nature, you have to ask yourself, are you acting from a place of deficit? And if so, where did that deficit start, so that we can rebuild it with truth, fact, and fact, versus your environmental upbringing? Because mental illness and distress is a combination of nature versus nurture. And a lot of people, especially in our community, as we grew up, we didn't learn um, healthy ways to balance our emotions, nor did we feel as though we were poured into, validated, and really comforted in an emotional, psychological, and sometimes even spiritual way. And so, as adults, I work with a lot of people in my appointments, where we are essentially rebuilding the foundation of that little boy and that little girl, and the core beliefs that were started back then that lead to dysfunctional patterns and cycles in their adult lives.
Something I really would like to touch on that just brought up, especially when we're talking about experiences of a lot of minority groups, especially for Black people. How
Hmm.
does stress impact mental health?
Stress,
Hmm.
it essentially exacerbates everything. If you can think about a piece of fruit, what's one that's really squishy and soft? Something that has a lot of pores, maybe a
Like
strawberry.
peach. Okay, strawberry.
Oh,
That's a good one.
a peach would be good. Or a strawberry. Think of a gigantic one, and you just continue to squeeze it. All
Mhm.
of that overflow that's going to come out is the anxiety and the depression and the irritability and the emotional dysregulation and the 0 to 100 real quick. Don't even come at me like that. Versus, you know, responding in an appropriate, well thought out manner. So when
Mhm.
what's really important for me, but also I think for every person who wears a lot of hats, or who feels as though a lot is on your shoulders, is making sure that you have activities in your everyday life, your monthly life, your weekly life, that counteract the stress. So, de stressing activities. That could be going to the gym. That could be an outlet with your church group. That can be going to the coffee shop to read your favorite book. That can be going on a walk, throughout the day. Sun is something that provides an increase in serotonin. Any type of activity that brings you joy, peace, and kind of takes the load off of your shoulders naturally increases your serotonin. Somebody might say, okay, well, why is that important? Because clinically speaking, serotonin is lower in the brain levels of people who are undergoing anxiety and depression. So if you can do a serotonin inducing type of activity on your own, you're essentially to a certain extent mimicking what psychiatric medication might do for depression and anxiety. And if you think about it that way, like, okay, I really like some of the young patients that I have. They're like, well, Dr. Mitchell, I really do like makeup. I used to have this YouTube channel, but I don't do anymore. I was like, okay, well, let's start doing makeup every week. I want you to do some looks. And when we meet next week or next month, let's talk about the looks that you did. Okay, you did those looks. What about start vlogging about it or do a journal about it? Do it for your friends. So it seems like things are really things that are really simple wouldn't help your mental health. But a lot of times when I get into appointments with people and we talk about, let's think about when you were your best, what was going on in your life? Okay, what activities were you engaging in? What work were you doing? Who did you hang out with? How often did you do this? And then we look at where they are now. A lot of those things have fallen by the wayside. And so you make a concerted effort to add in activities that help to minimize the stress so that the stress isn't the only aspect of your life that's overwhelming or ever present.
Right. I just want, for the sake of our audience, like, do you mind defining or just explaining what serotonin exactly is? I know you had said that it's associated with lower
Yeah.
serotonin is associated with anxiety and depression, but do you want to speak more to like specifically what serotonin, not specifically, but just get an
Yeah,
understanding of
yeah, certainly. So there are neurotransmitters, which are natural chemicals, a fancy word for natural chemicals in your brain and body that are responsible for regulating um, different emotional, behavioral, and cognitive controls. And serotonin is one of them, along with norepinephrine, GABA, dopamine. Dopamine is one of the um, neurotransmitter, neurotransmitters that is responsible for addictive properties or feeling good. It's a feel good hormone. Serotonin and norepinephrine are mood and anxiety stabilizing hormones. And for people who experience anxiety and depression, clinically speaking, when studies are done on the brains of those individuals, it has been found in really large studies of thousands upon thousands of people that those levels are lower, or should I say, available at a much lower rate. So the question is often like, well, do I make less than other people? Do I use more than other people? Why is my serotonin less? And that's not something that's easily understood because the brain is very complex. Behavior is very complex. There is not just the nature of who you are, but it's the nurture of the environment that you've experienced as well that contributes to your serotonin levels and your norepinephrine levels. So medications will target your serotonin and norepinephrine to allow it to be more available in your body. I get so many patients that say, well, I don't want to be on a psychiatric medication because I don't want anything that messes with my brain chemistry. I was like, well, do you ever take Tylenol? Do you ever take Motrin? That messes with your brain chemistry. It crosses the blood-brain barrier. It tells your brain to send signals to other parts of your body so that your autonomic nervous system brings your temperature down. And when I explain it in that way, people are like, oh, okay. So really all medications to a certain extent, if they're effective and not just local, can affect your brain chemistry. And that's the truth. The thing about psychiatric medications is it tells your gate channels in your brain that are responsible for helping these serotonin and norepinephrine levels recycle. It says, hey, don't pick up the serotonin so quickly. Don't pick up the norepinephrine so quickly. This individual actually needs to use it. So then the natural serotonin that is made then kind of builds up a storage. And that storage is what allows people to get better over time as it relates to medicine. And so if you engage in activities that naturally increase your serotonin because you enjoy them and because it takes stress off of yourself and you continue to do that, you can naturally also build up your serotonin and norepinephrine to a certain extent.
Okay, yeah. So serotonin, dopamine, these are basically feel good hormones. These are just what's associated when your body feels good. These are the hormones that are released in your body.
Well, they're the hormones that are a part of being responsible for that. I can't say that just the standpoint of feel good because they also do other things. But these, for example, some people who have too much dopamine can become psychotic. So,
Right.
a lot of drugs that can induce psychosis or perceptual disturbances work too much on the dopamine receptors in your body, and then people can go aloof. And sometimes it doesn't have to be synthetic drugs, it can be things just like, regular weed or marijuana can have those effects on people. But I would say, in conclusion of the neurotransmitters, is that they're all very important. And if there's a huge dysregulation, then behavioral and mental health is going to be affected.
Right. All right. So, what are 3 tips that you would give someone to best care for their mental health?
Hmm. One thing I would say is to be honest with yourself. Truly look at where you are, who you are, what's going on in your life, your internal thoughts, and evaluate if you are happy. And the word happy doesn't have to akin to the smiley face that we learned as children means happy, but where's your good spot, and are you there? And if you're not there, be honest with yourself at how much you're struggling and how far you've deviated away from that good space. And if that deviation has, you know, taken a turn for the worse, the second thing would be ready to take action. Um, the only way you can change where you are right now is by changing what you do next. So, whether that be seeking out the help of a mental health professional through counseling, or talking with a loved one to say, hey, I need some help, and maybe they help you gain access to your primary care doctor, or even going to call a psychiatrist yourself, their office, and say, I really think I need to schedule an appointment. Those are the first 2 things. So, honesty with yourself. And then, secondly, being ready to take action, because you can be the most depressed state of your life, the most anxious state of your life. But unless you're willing to take that step forward, to seek help or take medication, things won't get better. And I
Mhm.
would say the third thing is, when you get to a place of having someone either that's helping you or finding activities that help you, stay consistent.
Right.
Oftentimes people do the work to get better, whether it be therapy, behavioral intervention on their own, being involved in social groups, abstinence from substances, or taking medication. And once they feel better, they go back to their old ways. And then a couple of weeks or a couple of months pass by and they're back in the same place. Consistency is key to maintaining a good mental health. Um, you won't be able to do nothing and still have the same result,
Exactly.
of being well and being whole. It does take work, and it takes attention.
Yeah. Now, for you, what is your favorite way to take care of your mental health?
Oh, I have so many ways. um, so one thing that I like to do is divide up my time. I don't do any one particular thing 40 hours a week, because my internal self thrives on having new challenging things to do throughout my day and my week. And so I kind of set my life up like that. Another thing that's good for my mental health is time with family. So I always prioritizing having time with family away from work and away from duties and responsibilities. I've adopted the term no, or the word no, so that I can give to the lives, the parts of my life that give back to me, which is my family. I also work out. For me, if I don't work out, my stress levels build up more. My patience comes down less. And then I do things that I love, like shopping, meeting up with friends, getting my nails done, going to the spa, walking around the neighborhood with my kids. I make sure that I don't just bury my head down and do what's expected. I also lift my head up and do things that I enjoy.
I love that you shared stuff that was I think when we hear self care or taking care of your mental health, it's a good thing to do. Get your nails done or
Mm-hmm.
get your hair done, meet up with friends. Those are all things, those are all good things for your mental health and self-care as well, but also mentioning things that you incorporate into your daily practice, dividing up your time, spending time with family, something that's easily attainable, because self-care is, it's a lifestyle almost. It's a practice you do regularly. It's
Yeah.
not a massage that you book next week and then that's, you
Yes.
wash your hands and no more
Yes.
self-care for 3 more months, you
Right.
know.
Yeah.
It's consistent work that you're doing, preventative care, you know, almost, because you have to, when you
Hmm.
have to show up for yourself so you can show up
Yeah.
for things around you. So I really
Hmm.
appreciate you sharing that. And I
You're welcome.
really appreciate you being a part of this broadcast and for helping us and for having this conversation, and answering our community's questions. I'd
Yeah.
like to thank everyone as well for joining Ask the Doctor session today. Do you have any words or anything that you'd like to share, Dr. Mitchell?
I would just say if you leave this session today and you feel like something we talked about spoke to you, it's probably time for you to take action. And regardless of where you are in your life, things can get better. I have seen so many people who have come to me and said, you know, like I just feel hopeless, like nothing's ever going to turn around. And I just encourage them that I've seen people in your exact situation and worse that in a matter of weeks or months have made a complete 180. So it is possible. The only time it won't happen is if you stop trying. So that's my advice to anyone listening today. Don't stop trying. Be encouraged to put one foot in front of the other and go forward.
Right. And like you said earlier, if you're doing the same thing, you're going to expect the same results. So at least
Hmm.
do one thing different, 1% better each day. Just
Yeah.
take a step and do something different for your future self to thank you. But thank you again. This is only one of many of our Ask the Doctor sessions. So please follow, subscribe, and connect with us on our social media channels to stay up to date on our next event and all of our other great content. Find us on social media at Grapevine Health or our website, grapevinehealth.com. Special thanks to Fairfax County Health Department and the entire Stronger Partnership, Stronger Community Initiative for supporting today's event. And don't forget to use the QR code to complete the survey before logging off. Thank you again, Dr. Mitchell, and thanks again from the Grapevine Health team.
Thanks for having me.
Yeah. Have a good night.
You too.